Good morning, everyone. Welcome to the European Health Management Conference 2026. We are delighted to have you all here. I see a lot of familiar faces. Those of you who attend for the first time, well, that's not going to be just your first time. You will come back every other year from now on. Thank you all for being here. I am Federica Margheri. I'm the Executive Director at the European Health Management Association, the organizer of this conference. It is my great pleasure to welcome you to this beautiful venue and to Barcelona. I would like to immediately give the floor to Dr. Anthony Perez-Grau, the President of the European Health Management Association, so that we can officially kickstart the conference. Anthony.
So, benvingudes, benvinguts. Welcome, everyone. I'm really proud to have you all here. EMA Conference brings together lots of professionals from not only Europe, because more and more each year we are able to get closer to professionals that come from beyond Europe's borders. So this is an exceptional occasion. We can share experiences, share projects, and look at the future, and the present, of course, of health management. As you may see, the motto we chose, there are two important words. On one hand, changes. On another hand, the looks for bringing all of us together. There is something changing all along the world. In Europe, we are feeling it deeply. So the action is to be taken from right on, from this moment on. So this is very important that we may look not at the future, considering that the future is our present already. There is a Catalan song that's very, very deeply felt by many of us. It speaks, the name of the song is Any Day the Sun Can Rise. It's about imagination, it's about sharing. And I like this conference, as EMA has always been oriented to look for imagination, to look for sharing experiences. I won't keep longer. I just want to thank a lot our co-host, both ESE. We are in a magnificent setting, and we are to thank them for this, and also La Unió. Of course, the most important, it's the people, it's the attendance to any conference, it's the participants, but without the co-host, it cannot take place with such extraordinary venue. I hope that the next 3 days are really enjoyable, also profitable for your work, for your orientation, and let's go on. Thank you.
Thank you. Thank you very much, Anthony. And as you have mentioned, we are very thankful for the co-host and for being hosted at IESE Business School. And it is my pleasure to introduce Professor Evgeny Kaganer. He is Associate Dean for Academic Affairs and Innovation at IESE Business School. Please.
Thank you very much. All right, so first of all, welcome to Barcelona, welcome to IESE. On behalf of IESE Business School, it's really a pleasure and an honor to be co-hosting this 31st European Health Management Conference together with La Unió. So I guess one confession that I need to make really at the outset. So I have a special connection to the themes and the topics that you will be discussing. Many years ago, I was trained as a physician. Because of some very idiosyncratic historical circumstances, I never got to practice. But I have the connection on a personal level, on a professional level. So really, being able to understand this interface between the clinical side of healthcare and the management side of healthcare, sometimes it's really exciting, sometimes it's quite disconcerting if you think about how many issues and problems are actually buried in that interface. And I understand that a lot of the issues that you guys will be discussing is really about, in that very volatile context that we're living in today, how should we continue to change and continue to evolve that interface so that the care remains accessible, the care remains high quality, and so on and so forth. So let me just share a few details with you about your host, EHMC Business School. EHMC was founded in 1958 as a graduate business school of the University of Navarra. Today we are a top-ranked global business school with campuses here in Barcelona, in Madrid, in Munich, in New York, and Sao Paulo. But if you really look at the geography of our activities, programs, and other types of activities, it's very, very, very global. So it really spans all the continents from Asia to Europe to Africa to Latin America to North America, and so on and so forth. If you look at our portfolio of programs, it's also quite comprehensive. It spans the entire career arc, if you will, from what we call pre-experienced masters, young people that just finish their undergraduate degrees and they start with masters in management, masters in finance, and then it goes on to MBA, executive MBA. But historically, we have had a very significant commitment to executive education. And executive education means working with people like you and serving people like you, executives, managers, as well as the companies. That includes open enrollment executive education programs, what we call customized executive education programs, where we design and run programs specifically for companies. I guess what is really important is that EHMC sees itself as a professional school. And similar to medical schools, similar to law schools, professional schools are schools that serve the profession. So we serve the profession of people who manage organizations, who manage companies. And I think we take it very seriously, and that really shows up in many activities that we do, in the type of faculty that we hire, and so on and so forth. And on that note, if you think about healthcare management or management in the field of healthcare, this is not a recent interest of ours, a recent pivot of ours, right? So EHMC has been committed to healthcare management for many, 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 many years. And over these years, we've done and continue to do many different things. And if you look at the scope of these activities, again, they're quite diverse in the sense that we have MBA courses that are focused on healthcare management. We have themes related to healthcare management interwoven into different programs. We have dedicated programs for healthcare professionals. We run quite a few customized programs for various players within the healthcare ecosystem, from healthcare providers, hospitals, to pharmaceutical companies, global pharmaceutical companies, to insurers and payers, and so on and so forth, right? And management, I guess I'm preaching to the choir, but nonetheless, when we think about health and we think about medicine, a lot of the focus is actually on the care, on the craft and science of the medical care itself. So we tend to celebrate scientific discoveries, we tend to celebrate brilliant physicians and doctors, and we absolutely should. But management is kind of this necessary condition without which all these wonderful scientific discoveries and all these brilliant physicians are not going to be able to bring the value that they're able to bring to their patients ultimately, right? And so, and also management is where we're facing most of the problems today, right? With the demographic changes, with the population, I don't want to use the word aging, but nonetheless, that's the term that we're using today, right? And so as the number of people that require more care increases, and at the time we're experiencing significant, squeeze on public budgets and, workforce shortages and so on and so forth. So unless we figure out how to structure that layer that is between the clinicians and the patients, it's not going to work, right? And that's what this conference is all about, and that's why we are so proud, and so we feel that it's very important to support the conference and support the work that you've been doing. So we have been, as EHMC, we have been collaborating with many other institutions and schools, both on the educational side and the research side. You know, Jesse has been one of the founding members of the Business School Alliance for Healthcare Management, which includes leading business schools from all over the world, North America, Europe, Latin America, right? And schools that believe that helping develop healthcare managers is important. And so there's a particular commitment of incorporating these courses into the MBA programs, into other degree programs, so that you have a pipeline of talent coming into your ranks. We also believe that besides education, actually generating ideas is important. So we have a number of faculty that are very active in securing European grants, in conducting research on these topics, but most importantly, you know, consistent with our commitment to being a professional school, engaging with managers, engaging with practitioners, engaging with companies in the industry to generate these ideas, to conduct research, but also to help disseminate these ideas, right? So I guess one last thing that I wanted to mention has to do with the theme of this year's conference, which is From Strategy to Action. So as a faculty member for the last more than 15 years, my focus has been on transformation of large companies, not necessarily healthcare companies across the board, really from the senior management standpoint, right? So how do you really communicate the transformation ambition? How do you set up the organizational structures to make it happen? How do you sustain it over time? And when you think about this phrase, from strategy to action, I think it's a great phrase, but I also think it's a little bit misleading, because increasingly the boundary between strategy and action is disappearing. Because if you think about how we used to think about strategy before, we would set up an ambition, we would set up a goal, and then we'll decide on the roadmap, and then we will work hard on executing that roadmap. So if we think about how the environment is looking like today, it is becoming increasingly difficult, and I would venture to say impossible, to really define clearly what that to-be state is and define a roadmap that will stay stable as you're moving towards that to-be state. So what is really becoming important is the ability to, yes, set the direction, but then ultimately start acting upon that direction. And as you act, learn and understand better where you're trying to get and adjust the course along the way. And the whole recent, I don't even know what noun to use in this particular case, I want to say ordeal, but I'm not going to say that. So the recent developments around AI, and I'm spending a lot of time, or we're spending a lot of time thinking about, further or makes this need to act and make sense of what we do and continue to set strategy on an ongoing basis is even a bigger condition or even a bigger necessity for us. So this is not the first conference that we're hosting. We hosted one 21 years ago in 2005, right? And so it's quite interesting to see the world clearly is a different place. We are different people. The challenges are different, and at the same time, many of the challenges are similar. So you have 3 wonderful days in front of you with really a great lineup of speakers, discussions, presentations, and so on and so forth. And so I wish you really productive 3 days. I also hope that out of those 3 days, you will take away with you not only ideas, but again, commitments to action. But those commitments will not stay rigid, and you will be able to update as you go along. Welcome to Jesse, welcome to Barcelona. Thank you.
Thank you so very much. And I would like to invite on the stage the representative of our second co-host, La Unió. I'm pleased to have with us Ms. Elena Puigdeval, Deputy Secretary at La Unió and CEO at Fundació Espace Catalunya. Please.
Well, good morning, everyone. It's an honor to welcome you to Barcelona on behalf of La Unió, the Catalan Hospital, Health and Social Services Association, and to the European Health Management Conference 2026. Founded in 1975, La Unió brings together more than 100 healthcare and social services providers across Catalonia, aimed by a common mission, contributing to a high-quality, sustainable, and people-centered health and social care public system. turning diversity into cooperation, knowledge into action, and shared purpose into collective progress. Catalonia is recognized for an openness, research excellence, and healthcare ecosystems. It's a privilege to welcome you to Barcelona. We meet at a time of profound transformation across Europe. As Canadian Prime Minister Mark Carney recently reminded us at the World Economic Forum in Davos, if you are at the table, if you are not at the table, you are on the menu. An increasingly interconnected world, if you don't shape the future, someone else will. Then, precisely, our healthcare system and our welfare model is increasingly a European responsibility. A new stage is now beginning, and that connects health, well-being, prevention, and community, while placing people at the center of how we design and deliver care. It's also an opportunity to build models that are more human, more inclusive, and better able to generate equity. From Catalonia, we have learned that cooperation is one of the most powerful tools for managing complexity and turning diversity into transformation. This is also the mission of La Unión, creating spaces of trust, where shared knowledge becomes collective action. The future of healthcare systems will depend on our ability to transform knowledge into action, innovation into impact, and strategy into results. The future of healthcare system will depend on our, because transformation does not begin with the technology. It begins with a shared vision and with people capable of turning that vision into reality. That is why we need spaces like EHMC, spaces where collective intelligence becomes collective action. The great challenge of the coming years will not only be imagining the future, but turning good ideas into a real change that improves people's lives. Because strategies inspire, yes, but execution transforms. And this is where leadership becomes decisive, leadership that creates trust, connects diverse stakeholders, and drives change that no organization could achieve on its own. The decisions we make today will define the healthcare system future generation inherit and the opportunities we able to offer them. Better care, healthier lives and services that are more equitable, sustainable, and inclusive and accessible. This is a demanding moment, but also an extraordinary opportunity to shape the future of health. If this is one lesson from the experience we will share over these days, it's that the future is not improvised. It is built with leadership, with trust, with knowledge, with responsibility, and with a willingness to work together for a purpose greater than ourselves. So, if there is one lesson from European experience, it's that the stronger systems are not simply the most efficient. They are also the ones that generate trust, protect the most vulnerable, and reduce inequalities and combine excellent sustainability and social commitment. This is, perhaps, the great responsibility we share, because the future is not a reality we simply wait for. It's a possibility we build. Every decision, every innovation, every partnership, every professional we inspire, every citizen we place at the center. And finally, there is a phrase that is someone heard when Europe is viewed from outside its borders. Europe is a beautiful museum with an excellent health system. Well, whether we agree with it or not, but it reminds us of something important. Our challenge is not only to preserve what previous generations built. Our challenge is to continue transforming it, to ensure that Europe remains capable of combining innovation, competitiveness, social cohesion, and high-quality public services, to ensure that our welfare model remains a source of strength and leadership in a changing world. Because the future of Europe's health system will not be defined by what we inherit. It will be defined by what we are capable of building together. Welcome to Barcelona and welcome to EHMC 2026. Thank you.
Thank you so much, Elena. And of course, we thank the co-host for making this conference possible. But this conference is also made possible by a lot of other partners and supporters. And it is my great pleasure to invite on stage Ms. Laura Ivenou. She is the head of public affairs at Sanofi, which has been a great partner along the years and especially for this conference. Laura, please.
Bon dia, good morning everyone. It is a pleasure to stand here today at the opening of the EHMC 2026 alongside such distinguished leaders, policymakers, healthcare system executives, academics, and you are who are the architects of the future of the health systems transformation. And the question at the center of this conference, how do we build health systems that are resilient, equitable, and sustainable in a rapidly changing world, could not be more timely and more urgent. We have listened to the previous speakers, and we all know that we are navigating simultaneous pressures, demographic changes, technological transition, disruptions, environmental challenges, and rising societal expectations. And yet, among these many challenges, one touches us in every breath as we take. And this one just remains critically under-recognized. And I really believe that it is in the heart of the resilience of the health system resilience. I'm talking about the growing burden of respiratory diseases in our aging societies. I'm sorry, I will take the word about, and we will talk about the aging societies because it is in the center of the pressure of our healthcare systems. And I would like to start with numbers because these numbers really demand to be heard. Respiratory diseases are the third cause of mortality globally, responsible for approximately 4 million deaths in 2019 alone. 454 million people worldwide live with chronic respiratory diseases, such as asthma, COPD, and these conditions are lifelong, progressive, and deeply interconnected with infections disease risk. And not only that, chronic respiratory diseases alone cost the EU 800 billion euros in 2021, a figure that will only grow as the population ages. So as the world and Europe in particular is aging at an unprecedented pace, by 2050, more than 2 billion people globally will be aged 60 plus. And Spain, where we gather today, is a frontline example in where we have the oldest population here in Europe, but we can see now that the demographic pressure is already visible in hospital occupancy and system strain every winter. And when we combine age and the chronic diseases, what we can see is not only adding risk, it's really a multiplication. The consequences cascade is far beyond the lungs. What we have seen is that influenza is associated with a 24% increase in heart failure hospitalization. 93% of COVID-19 deaths occur in people aged 65 plus. Approximately 50% of RSV hospitalized older adults develop serious complications, and pertussis, which is normally associated with infants and childhood disease, really triggers exacerbations of COPD or asthma, causing hospitalization and long-term functional decline. So in summary, People are living longer, but they are not healthier. And the gap between life expectancy and the healthy life expectancy continues to widen, and now is nearly 6 years spent in poor health. When we are talking about COPD, a person with COPD who contracts influenza faces compounded risk. The infection triggers the chronic condition amplifies the infection severity. At the end, we need to address with prevention plan both as integrated priorities, not siloed interventions. And really, we believe that the next respiratory threat, and we have just lived one 1 month ago, may not announce itself. And our systems must really be ready before it does. And what we need to do is really to strengthen our surveillance system. We need to go further than influenza, COVID-19, RSV, because there are pathogens really dangerous absent from the surveillance system, such as the human metapneumovirus, the HMPV, which can pose significant risk to older adults. And this is how related today preventable hospitalization, overwhelmed capacity, seasonal readmissions, healthcare worker exhaustion, a cycle that repeats each year and intensifies. So if we are, you are in the center, you are asked to do more with less. And prevention is really one of the drivers you can active. We were talking about strategy to action. This is one of the action plans that really is in your hand to be put in place. We know that adult immunization delivers returns up to 19 times the investment. If we compare it to smoking cessation programs, which are 3-4 times their investment, it's much broader. And the evidence is compelling. When we're talking about flu vaccination, it reduces cardiovascular related death by 33% in people with cardiovascular disease. And it demonstrates that respiratory vaccination protects far beyond lung. COVID-19 vaccination prevented 2.53 million deaths globally, 90% in next year, in 60+%. And we have proof of it here in Spain. The RSV National Immunization Program for infants has demonstrated that when political will and cross-functional coordination is done, then we can decrease dramatically infant hospitalization, reduce ICU admissions, and really protect healthcare capacity during winter months. But I'm sorry to say that we are moving in the wrong direction. If you see the adult vaccination rates, we have really seen a drastic diminution with 100 million doses less in this post-pandemic campaign if we compare with the pre-pandemic levels. So the cost of inaction is measured in life, is measured in independence, and billions of euros that are available in the healthcare spending. For too long, immunization has been framed as childhood intervention, and really, if you see the demographic demands, we need to think of adult immunization as a must. It should become a pillar of the healthcare strategy. And the question is no longer, can we? The question now is really, will we extend the same commitment through national respiratory plans that protect all ages, especially our oldest citizens? And we are in a cornerstone, the future, to prepare our systems for the future. We need to connect long-term priorities with today concrete actions. And no single actor can do it alone. We really need cross collaboration with policymakers, health managers, regional and local governance, because the solution exists, and the challenge is the speed and the coherence of implementation. So for those who want to learn more about strategic framing to go from strategy to operations, I warmly invite you to join the session we will have on Thursday at 2 p.m., which is called From Underestimated Threat to System Priority, Strengthening Respiratory Infectious Disease Surveillance and Immunization in Europe, where we'll go deeper in the surveillance systems, gaps, underestimating pathogens, and what truly resilient respiratory health strategy looks like for Europe. For my closing, I really would like to highlight that respiratory health and immunization are not peripheral to the question of health system resilience, are really central into it. And the future of European health system resilience will be built or not if decisions are made today and you are in this room to really talk about that. So thank you very much to EHMA. Thank you, Federica Marguerite, for the privilege of opening this conference. And I wish you all every success as this conference. Thank you.
Well, thank you so much, Laura. And last but certainly not least, it is my privilege to invite on stage Mr. Jordi Vilana. He is Director General for Health Professionals at the Department of Health at the Generalitat de Catalunya.
Okay. Bon dia a tothom. Good morning to everybody. It's an honor for me, for us, to welcome you on behalf of the President of the Government of Catalonia to the European Health Management Conference 2026. I would like to begin by sincerely thanking European Health Management, la Unió Catalana d'Hospitals, ES Business School for the invitation and for the effort involved in organizing this gathering of healthcare leaders and managers, researchers, data experts, innovation specialists, pharmaceutical industry, university students, and healthcare professionals who are both concerned with and committed with health management. Thank you. For the Department of Health, we wish to express our deep appreciation for organizing this conference. A conference of this kind so successfully. The success of this event is yet another sign of the quality of the organization and of the great need of our sector has for gathering like this one, as we commented before. Suffice it to say that registrations were fully booked 2 months ago, and that more than 50 abstracts were received. It's really a success. Congratulations. Such broad participation and such a comprehensive program have a clear sign of your commitment to excellence. Second, we wish to express our deep appreciation for the work carried out by healthcare leaders and managers, both for the perspective of the public health system and for the perspective of managing healthcare organizations. We do not often have the opportunity to acknowledge your work and highlight the importance of health management in the face of a society undergoing constant change, marked by growing uncertainty and ever more numerous and complex challenges. This makes it necessary not only to recognize the value of leadership and health management, but also work for professionalizing them in order to guarantee the highest quality of care for citizens. As policymakers and as health managers, we should be capable of foreseeing, anticipating the most appropriate strategies to action, and of working to ensure the resources needed to make them possible. Financial and technological resources, and of course, the availability to the right professionals in the right place with the required qualifications, while also seeking to ensure that they remain committed and shared to the purpose of the organizations and the system. It's not easy. Your work, which is often quiet and goes largely unnoticed by the public, and that is usually carried out in offices and meeting rooms. Your work, as I said, helps to improve the smooth running and performance of healthcare systems and care organizations, but it also helps to improve people's quality of life and independence, and this is very important. Looking to the future, of course, we are facing major challenges in our public health system, a system of which we are very proud. Our system, the Catalan health system, is an universal public system with universal access, with a long-standing tradition and proven strength and good results. The Catalan health system is distinctive because, among other features, unlike other public systems, it maintains a separation of functions. Regulation and planning are the responsibility of the Department of Health. Financing and insurance are the responsibility of the Catalan Health Services. And third, the service provision is carried out by a broad network of providers of diverse ownership. And this is very, very singular, and this is very effective. As for the major challenges in our public health system, as is the case in other European countries, our system faces growing pressure on demand due to aging and chronic conditions, limitations in accessibility in waiting lists, economic sustainability and financing, environmental sustainability too, and the incorporation of new technologies and cultural and social change between others more. And as a public health system, we also face the major challenge of workforce availability and generational renewal, which implies a limitation in some specialties and in certain territories, as well as situations of violence affecting daily work and the discomfort experienced by some groups of healthcare professionals for causes both internal and sometimes external to the systems. And it's for that we think that these challenges require not only planning and rigor with data, but also imagination and daring to do new things, to be creative, as you said. It requires us to be bold in implementing the changes and transformation processes needed within the system and organizations to meet the challenge. They also require strong leadership and good management. Clinical and organizational leadership is needed to ensure the proper functioning and outcomes of the health system, organizations, and services. And is why I would like to make you two requests as policymakers, as leaderships. First, as drivers of change, we need your ideas. We need your experience. We need your capacity to innovate within organizations and across the healthcare system as a whole. I ask you to dare to put forward proposals for improvement and health strength management leadership so that together we can build a resilient and high-quality health system and healthcare organizations. Second, to continue preserving the human value of care in an increasingly technologized context with every day more data, more control system, more technology. We must not lose sight of human treatment, both in relation to users and to the professionals. I ask you that we have to continue to place people at the center of our management, users and professionals. Yeah. To conclude, I would like to emphasize three key ideas. First, recognition of your work, your good work and commitment in healthcare leadership and management, in research and innovation too, to improve not only the proper functioning and outcomes of the health system and healthcare organization, but also people's quality of life and autonomy. Second, a request that you continue to dare to put forward proposals for improvement, that you dare to take action, and those of you who can, health strength, good management and leadership so that together we can build a resilient and high-quality health system. And third, a reaffirmation of human treatment as a fundamental pillar of healthcare and health management too. I ask we continue to place people at the center of our management. I insist, users and professionals alike. Finally, thank you again for inviting us to this conference. We wish you a conference that meets all your expectations. Thank you very much.
Thank you very much, Mr. Villana. And I would like to conclude this opening ceremony by really taking a moment to thank the many partners that have helped making this conference possible. I would like to mention once again Sanofi, MSD, the European Observatory on Health Systems and Policies that have been long-standing partners and friend of this conference, HealthLean Analytics, the Univans of Healthcare Excellence Award Program that is an initiative by Abbott, and you will be able to learn more from them at this welcome reception tonight, but also at the session tomorrow. The Be Well Project is also a supporter of this conference. We also have the support this year and the presence of the WHO Barcelona Office for Health Financing. They have a beautiful stand that is waiting for you and a lot of publication that you can learn from, and I strongly encourage you to go and profit from them. They will also have a session later today. We also have the WHO Office on Quality Care and Patient Safety. They will have a session this afternoon. And we also have the Joint Action Heroes here with a session also this afternoon. And then many other partners, IRIGA, the International Foundation of Integrated Care, and several projects where Emma and many other partners, some of which are here, are also involved in. I would also like to let you know, if the clicker supports me or if somebody can... Fantastic, thank you. That the European Health Management Conference has been this year accredited by the European Accreditation Council for Continuing Medical Education with 13.5 European CME credits. This means that each and every one of you can claim these credits, and the accredited session will show a QR code that you can scan and through which you can register your presence to then claim your credits. Of course, if you have any questions, there will be staff in the rooms that can support you into claiming these credits. But we think that this is a great advancement. This is the first year that the conference is accredited, and we hope you can profit for these. I would also like to encourage you to attend as many sessions as possible. There is a great wealth of knowledge in this room, and there will be a lot of knowledge to be shared, not just in the oral presentation, but there is also a great display of posters, and there will be poster pitches. So please do also go and check out the different posters through the screens, and don't forget to vote for the People's Choice Best Poster Award through the QR code that you will see displayed on these screens. I am just left with thanking you for being here. I wish you a wonderful 3 days at the European Health Management Conference 2026. You can already see in this slide that a lot is coming up next. Enjoy, and we'll see each other around, and have a wonderful next 3 days. Thank you so much.